Julie Lewis lives on the Upper West Side of Manhattan.
Are you surprised to see me? Oh, yeah.
She managed to make it to Virginia to visit her 93-year-old father at Brandermill Woods in Chesterfield.
Happy birthday, Julie. Thanks, Dad. I'm really old now. No, you're not.
So far, 9 residents at this long-term care community have died from COVID-19. More than 20 residents and 17 staff members have tested positive for the virus. Thankfully, Harry remains COVID-free, but Julie is constantly worried that he might get it.
I mean, that's like the scariest call you can get.
Thus far in Virginia, 190 long-term care facilities have COVID outbreaks, and 708 residents have died from the coronavirus. They account for nearly 60% of all COVID deaths in the state. Remarkably, the Virginia Hospital and Healthcare Association reports a number of elder care communities are still having trouble obtaining personal protective equipment.
It's unacceptable that these communities can't get the appropriate equipment that they need.
16 facilities report needing isolation gowns, which are something Dr. Jim Wright, who is the medical director at Canterbury Rehab in Henrico, that's the site of the state's first and hardest hitting outbreak where 51 residents died, said is critical to stopping the spread.
It's the reusing of gowns that really puts our elders at risk.
Even at Canterbury, where they are now taking in recovering COVID patients from hospitals, the staff have to reuse gowns.
But this takes that extra step, and it does make it more dangerous as a result.
To that point, Governor Ralph Northam recently highlighted Virginia's efforts to build up PPE supply.
We are now at a place where our hospitals have an adequate supply. Additionally, FEMA is shipping some PPE directly to nursing homes. If healthcare providers working to fight the COVID-19 pandemic need PPE, we will make sure they have it. They just need to please let us know.
Dr. Danny Avula, head of the Richmond and Henrico Health Departments, worries that as we reopen, we will see more cases in long-term care. I understand everybody's competing for these supplies, but if 60% of the folks in Virginia that have died from COVID-19 come from long-term care facilities, shouldn't you be putting all your supplies in those facilities?
It does raise some concerns for me, just because what I continue to hear is that we don't quite have everything we need.
On the other hand, testing, which has been a major issue in Virginia, recently ramped up. The federal government strongly suggested that every elder care facility test every resident and staff member this month. And Dr. Avula says we now have the capacity to do so, yet some facilities are pushing back.
There have been, for various reasons, but hesitations on the parts of typically the corporate ownership of facilities.
Dr. Wright blames potential staffing shortages and bad press.
And I totally understand both of those impulses. In the end, though, you've got to know.
Speaking of that, Virginia does not report the names of facilities with outbreaks. State officials say Virginia code does not allow the release. But Joni Latimer, the state's long-term care ombudsman, says residents and their families deserve to know.
It makes sense that they want to know this. And I think, it seems reasonable to me because they're having to make decisions about their own care.
Decisions that could mean life or death.
Love you, Dad. Be safe. All right.
That leave loved ones like Julie Lewis holding back tears.
All right, bye. Bye. Oh, my God, that's so sad.
And angry.
I don't understand why the state feels the need to hide this information.
Although the state is not releasing nursing home specific information, the federal government is expected to do so by the end of this month. Dr. Wright says he believes ultimately the state will mandate testing for all residents and staff members at some point. He also says going forward, as we start to reopen, it will be absolutely critical to test staff as frequently as possible. Working for you, I'm Melissa Hippolyte for CBS 6.